Welcome, dear student. The technique I would like to discuss is the first technique I usually use when a patient visits me in my office. This is the GRAT technique. This technique involves grabbing pins, 5 for one hand, as a rule of thumb. You can use 6 or 7, but generally, there are 10 pieces in a set, so 5 per hand. And we position the hand like this. We tuck in 3 fingers, place the pins, bend the finger as if pulling the trigger, and add the thumb. With the pins arranged like this, I open 3 fingers and often align the pins on the patient's skin. Gently, I do the same with the other hand. Now, what does the GRAT technique look like? The GRAT technique should be performed with quite a large amplitude, at a high frequency, like this. Slowly, this is a very slow tempo, in fact. Fast. From my experience, I've noticed that when my fingers are resting on the body, it's more comfortable for the patient. For us, it also helps with the entire movement involved in the GRAT technique. What don't we do? We don't make movements like this. We don't do these, and we don't scrape. We perform the technique. How long do we perform this technique? As long as it takes for mechanical hives to appear, or until the patient says they already feel improvement and no longer have pain discomfort. And what is important, also some patients' skin will be more reactive and sensitive, while others will be less so. That's why we also have to take into account the intensity of the stimulus, so as not to cause any cuts. If we accidentally make a small cut on the patient, which sometimes happens, we use hand disinfectant. And when it comes to the pins, we disinfect them just like any other tool, so there's no major issue here. That's what the GRAT hail technique looks like. Thank you for your attention.